If you look at clavicle superiorly, it has two ends, acromial or lateral end and sternal or medial end, and a middle portion called the shaft, also known as body. Acromial end is also called as extremities acromialis. It is a flattened end of clavicle, which is rough inferiorly. It is the part of clavicle facing towards your shoulder. It has an oval facet which articulates with the clavicular facet on the acromion process of scapula. The margin of this end gives attachment to capsular ligaments forming the acromioclavicular joint. It also has an attachment point to the coracoclavicular ligament. Now here you shouldn't get confused with these two terms. The clavicle forms a joint with the acromion process of scapula called the acromioclavicular joint. At a different region, it also gives attachment to the coracoclavicular ligaments attaching the coracoid process of scapula to the clavicle, but it does not form a joint with it. The other end is the sternal or the medial end. This is the part of clavicle that is facing towards your body. It is basically a rounded end which articulates with the clavicular notch of manubrium sterni. It gives attachment to the intraclavicular ligament, which binds both the clavicles on each side, and also has an articular disc for the sternoclavicular joint, giving attachment to the capsular ligament of the joint. Coming up to the shaft, it gives attachment to muscles, which we will discuss later in the lecture. It has two halves, medial 2/3 and lateral 1/3. Taking lateral 1/3 first, it is flat. There are two borders and two surfaces. The anterior border, which is concave, and the posterior one is convex. A superior surface and an inferior surface that is towards the opposite side of this bone. Then comes the medial 2/3. It is quadrilateral, having four surfaces named as the anterior one, which is convex, the posterior one, which is concave, and it has superior and inferior surfaces. 80% of fractures occur on the middle 1/3 of the shaft of the clavicle, as it is the weakest point of the bone. Strong clavicles of adults are less frequently fractured than slender ones of children.